groups supported the new health law. They were part of working with Congress to get it passed. What they are concerned about in terms of payment is actually a law that was passed in the early 90s, which set up a sort of automatic formula for paying doctors for Medicare services. And what the law basically said is, we're going to pay doctors so many % more than inflation, and year after year adjust the payments. Well, that was fine for the first several years. And then what happened is medical inflation got way ahead of consumer inflation. So doctors, if the law had been followed, would really be looking at a cut in pay, not an increase in pay. Congress, since the late 90s, has not ever fixed that underlying law permanently. They've done it a year at a time. So every year, doctors are looking at if the underlying law would go into effect, they'd face a severe cut in pay. The president has said since he was elected, and we've had several bills pending in Congress, we've got to fix this, and we've got to fix it permanently. Doctors should not have to come to Congress every year, lobby Washington, worry about whether or not they're actually going to get paid or not. We've got to get rid of the underlying law and fix it. So the debate about pay really doesn't have to do with the new Health Care Act. It is a law that was the Balanced Budget Act in the early 90s, and we are working to fix it. Right now, again, Congress has done a short-term fix. Doctors are assured of their Medicare pay, but just until the end of the year. So again, there is going to be a crisis where physicians are looking, if the underlying law went into effect, doctors would have a 21% pay cut, which clearly would end Medicare. No physician would take new patients, and many would not keep their current patients. So it's something that we really need to fix, that we're committed to fixing, that the president is committed to fixing. We just have to get Congress to step up and help us and do a permanent fix, not 6 months at a time, and keep doctors in a position where they really don't know next month or the following month if they're going to get paid.
Thank you.
More questions?
Thank you so much, Madam Secretary. I was really not quite sure about the long-term care and the new, and if you could explain that, I'd really appreciate it.
Sure. Yeah. Well, there are a couple of features, but there is a new provision that is called the Class Act, and it was a separate piece of legislation that actually had been debated in Congress for a while and not passed, that was included in the overall Affordable Care Act. And what the Class Act is a voluntary payroll deduction that would be available to anybody who wanted to participate. And if you're not working and don't have a check coming in to pay, you could actually set up a separate account. And it allows people to pay into an account, and over time that account builds, and then withdraw that money on a daily basis to really pay for a whole variety of what would be home health services. So the program is just beginning to be set up. You'd have to pay in for 5 years before you withdraw the money. It isn't a long-term care policy. It isn't an insurance policy. It really is an opportunity for a lot of, I would say, younger and working Americans to begin to plan for the future, to say this is an important piece of it, and that you would have then your own, almost like Social Security, you would have a savings account to draw upon. You would have a certain set amount that you would get every day, and it helps a lot of people age in place, so they could help pay for if they needed a visiting nurse to come in, if they needed some home health assistance to actually not end up going into a nursing home, but to stay in their own home longer, if they needed some care along the way. It's been talked about for a long time, but it just has never been set up before, and that's what the Class Act will do.
Wouldn't affect us.
Yes?
Is there anything your agency can do about private insurance companies who raise premiums? There's a story in the LA Times this morning about Anthem, which is raising premiums 20%.
The first group to look at insurance rates are the state insurance commissioners. So in California, the rates that Anthem charges actually go to the insurance commissioner's office first, and each state has a different set of laws. What we don't have, and the new bill didn't create this, the federal government won't be looking at rates of private insurers. It will stay with insurance commissioners. But what we know is a lot of insurance commissioners, like here in California, don't have the range of laws that they need. So we have actually begun to send some help to the states, some resources to say what you need to do is improve your regulatory authority, hire more staff, and actually in California what they say they're going to do is go back to the legislature and get approval for the law which would allow them to look at the rate before they went into effect. Right now companies can file a rate and at the same time file it with the commissioner's office. Now if you remember, Anthem did 4 months ago filed rates that were actually going to be 40% increases and sent those notices out, and there was such an outcry, including from our office, saying, you know, these don't seem to be justified by a company that just filed a multi-billion-dollar profit statement to turn around 6 weeks later and raise rates for 40%. So those rates were withdrawn, and 6 months later, it's estimated that the citizens, even though they will get a rate increase, they'll get about half the rate increase they talked about, and they'll save about $180 million, which is a pretty big drop from where they were. But California still needs more authority to actually review the rates in the first place. They found that Anthem had actually filed the wrong trend. They said that the costs were going up by a % that just weren't justified. So we really need on-the-ground regulatory oversight and in states across the country, and part of the bill is to provide more resources to the state insurance commissioners to do just that.
I think we have time for one more question. If anyone has something
That's also one of my former lives. I used to be an insurance commissioner, so I kind of know what these guys do and how they should do it. Yes, ma'am.
Shingles is a terrible disease for people when they get older, and there is a vaccine that you can have that prevents you from getting it. I had to pay $300 for a shot. It isn't given by Medicare. Is there anything in the new bill that will provide that? I mean, that's what it seems to me. It'd save a lot of money for Medicare if they gave the shot. Or
I'm not familiar with, I am familiar with shingles. My mother had shingles, and it is an incredibly painful and awful disease. I don't know about the specific vaccine. What I do know is what the bill says is that if there is a group of medical experts called the U.S. Preventive Services Task Force, and what the bill says is that anytime this medical group recommends a prevention treatment as either an A or a B. They categorize treatments that they think are most effective and most beneficial, and they do A, B, C, and D. So if you get an A or a B by the U.S. Preventive Services Task Force, which updates their recommendations on a regular basis as new drugs and new screenings and new tests come out, then it's automatically covered, and it's automatically covered without co-pays. So I just need to go back and check on the shingles vaccine. I don't know if the Preventive Services Task Force actually has dealt with that yet, but if so, it would become part of the benefit package automatically, and it's kind of progressive going forward. So as the medical group updates preventive services, they become part of the package.
Okay, I guess thank you all for being here. We do have refreshments outside if you want to join us in the little we have cookies and stuff out in front there. And Secretary Sebelius, thank you so much for coming and talking to us. No, and it doesn't take a lot to keep just a little bit of support services and some of the budget. So,
I'm fine. I think I'll. Yeah, what's water?
This is Susie, our Chief Operating Officer.
Nice to hear you. Thanks so much. Hi. We're trying to get the word out that this is serious business and we're done with save money and the services and benefits. It's like, you know, they can either live in the scumbags or to the good people. So
It's important. That's why we're here.
so Paul, how long have you been the director?
I've been the director